New at 11, the State Senate Appropriations Committee has set aside $78.9 million for Baker Act services. But experts in the healthcare industry say that won't nearly be enough. Baker Act is the term commonly used in Florida when someone is involuntarily hospitalized for a mental health crisis.
The number of people needing that kind of medical care has increased sharply, leading to overcrowding in some mental health units. News 6's Troy Campbell is live in Orlando. And Troy, you found out this is a problem all across the state.
Yeah, the Florida Hospital Association says right now their providers are admitting more Baker Act and involuntary psychiatric holds than ever before. And they say the simple truth is their providers don't have enough resources to meet patients' demand.
When someone needs to get into a mental health practice, that door needs to be immediately open, not 6 weeks, 6 months from now. They're in crisis and they need access to those services.
Florida Hospital Association President and CEO Mary Mayhew says mental health service providers are being tasked with providing emergency medical health care beyond the capacities of their facilities. The Florida Hospital Association says of the 82 facilities surveyed, the combined yearly amount of involuntary admissions is nearly 78,000, or about 950 admissions each facility. Marnie Stallman is the president and CEO of the Mental Health Association of Central Florida. Her organization provides a guardian advocate for people during these emergency medical holds.
So that when individuals that may not have a family member here in the area that can serve to help them with informed consent while they're in that inpatient involuntary state of the Baker Act, they have somebody there that's advocating on their behalf.
The FHA is also calling for an increased reimbursement. The association says involuntary or Baker Act discharge costs each reach totals between $6,000 and $8,000. Mayhew says right now the government reimburses less than half that amount. Mayhew and Stallman both say detection and a treatment plan for a mental health illness prior to an emergency could help alleviate some of the total costs for the state.
Help them getting access to community-based mental health services, medication management that often can prevent some of those hospital admissions and readmissions.
And the Florida Hospital Association also says Florida desperately needs more mental health workers. She says, or the woman we spoke with in the story with the organization, she says that Florida averages one mental health worker for every 550 patients, adding that's one of the worst rates in the entire country. Live in Orlando, Troy Campbell, Getting Results, News 6.